Hi, I'm Ted Kruse with Physical Therapy Solutions, and today we're going to talk about elbow injuries, specifically with young throwing athletes. The most common elbow injury that we come across and that the public typically hears about is the ulnar collateral ligament injury. Surgery for that is called the Tommy John surgery, and that's the most common kind of phrase people bounce off us when they come in with elbow pain. The ulnar collateral ligament is a ligament on the inside of your elbow, runs right through here. And if that is damaged, that's typically the location of the pain. It's typically an overuse injury, and what we come across with, especially the young throwers, is exactly that, overuse, where they've maybe been throwing too long of a season, or maybe not having enough time off in the off season. An ulnar collateral ligament injury also appears to be an issue of age or maturity. What we find is that an older individual, somebody that's skeletally mature, if they do have an injury there, they could tear or rupture that ligament, which would require fixation or the Tommy John surgery. If somebody is skeletally immature, meaning those bones haven't fully formed, there's a growth plate there, and you can get a fracture through the growth plate. So instead of rupturing that ligament, you actually get a fracture through the growth plate because that's the weak part of the elbow. And symptoms are similar. They could feel a pop when they throw, a lot of sharp localized elbow pain on the inside of the elbow. That will not be typically surgically repaired. You would follow up with an orthopedic physician in that case and determine if it was something that required surgery. Oftentimes it's going to require rest, and our body will heal that up on its own. The important thing to remember with these type of injuries is to take pain and some of those signs and symptoms that they may come across or may present with, take them seriously. As a thrower, as an athlete, as a parent, and as a coach, if a kid is having elbow pain specifically on the inside, but in general, if they're having elbow pain, we need to pay attention to it. They may just require some rest, some time off of throwing. Could still play baseball. They may need to play some other positions or have somebody play the field for them while they hit. And maybe they need some time off completely, depending on their symptoms and their track record or history with playing that prior year. A general rule of thumb is 3 to 4 months off of throwing, completely off of throwing, is advised. That's from the American Sports Academy. It's best practices for young athletes to take time off. Throwing is a violent movement. It can put a lot of stress and strain on the elbow and the shoulder. So taking time off of throwing is advised. They also have pitch count regulations for different age groups. That's followed amongst most little leagues and tournaments now. So please stay close, keep a close eye on those as a coach and as a parent, and make sure those aren't being violated and followed closely. If you can do those things, hopefully you can stay ahead of injuries like this. But again, if those symptoms do come on, feel free to follow up with a medical provider. A physical therapist can look into this as well and help determine if this is something that you need to look at further. I've had a lot of young athletes and parents also discuss different options of hopefully preventing this down the road beyond the required rest needed. We can look at things like throwing mechanics can play a role in it. Also general strength. Sometimes as a young athlete gets a little bit older, they're ready to start looking into strength training, and we can look at the right options and methods to accomplish that to hopefully prevent injuries down the road. If you have questions on elbow injuries or baseball and throwing injuries, feel free to contact us at Physical Therapy Solutions in Dyersville or our Manchester location. Thank you.